Some government leaders are sounding the alarm about how the coronavirus crisis could eventually stretch hospitals to their breaking point. New York Governor Andrew Cuomo warned yesterday the country does not have enough hospital beds to handle a pandemic. And now, as Carter Evans shows us, healthcare workers are voicing their concerns about shortages of some crucial medical supplies.
You have people on gurneys in hallways. That is what is going to happen now if we do nothing.
As hospitals across the country brace for a surge in patients, some healthcare workers say medical equipment shortages are already putting them and their patients at risk.
Give us the protections that we need to give the care that our patients need.
Bonnie Castillo is the executive director of National Nurses United. One of their main concerns, a shortage of N95 masks that can filter out 95% of airborne particles. Last week, the CDC posted new guidelines saying healthcare workers could use the looser fitting surgical masks as an acceptable alternative.
Nurses are being asked to actually reuse masks, including surgical masks, which provide no protection.
The nonprofit organization Direct Relief, which helps equip doctors and nurses, manages this massive California warehouse stocked with essential supplies, including N95 masks.
There's a high risk we could run out.
CEO Thomas Tighe says they've been contacted by at least 150 community health centers lacking supplies. After donating nearly 1 million masks to China earlier this year, they have less than 500,000 left in stock.
We could run out of them today if we tried to respond to every order that we have pending.
The Association of Public Health Labs says some of the chemical ingredients used in coronavirus tests are in short supply. Diagnostics testing giant QIAGEN, one of the companies that makes them, says they've increased production to 7 days a week to keep up with demand.
It's spreading much quicker than what we have seen before. So the surge of demand everywhere in the world, and specifically in the US, is quite significant.
And the American Red Cross says there's a severe blood shortage. 2,700 blood drives have been canceled, resulting in 86,000 fewer donations. Healthcare workers say the protective measures taken over the next few weeks will be critical. Nurses and doctors are already getting sick.
Yes, that's true, and more will. And as more get sick and have exposure, we get sidelined. And then who's there to take care of the patients?
For CBS This Morning, Carter Evans, Los Angeles.